Hey there, this is Jim,
And Ralph?
and we welcome you to another podcast of Psychology Takeaway, where we attempt to put interesting and relevant information in the field of psychology into some sort of a perspective that you just might be able to use.
Well, one of the things we're going to talk about today is surprisingly not directly related to psychology. It's indirectly related to psychology, but we are going to talk about a painful subject. We're going to talk about
Pain,
pain.
yes. Well, it's kind of interesting, Ralph, that when you take a look at the reason why people go to see doctors, about 80% or so of the visits are pain related.
Yeah, now that seems like a high percentage, but basically, unless you're going in for a regular checkup, if you think about it, I mean, when do you go to the doctor? You say, I hurt.
Uh-huh.
I'm not getting any better. I guess I should go and see my doctor.
Yeah. So the it's kind of interesting when we take a look at pain. About 20% of the people on the planet are experiencing chronic pain. That's pain that is there every minute, every hour, every day, and it doesn't go away. We're not talking about a headache after you have imbibed too many
Too many martinis.
too many adult beverages. Yeah, we're talking about something that goes on day after day after day. So you figure 20% of the population. That's a lot of people.
Yeah, and that's at any one time. So it might be a different 20% today, but it's always there. It stays pretty much steady at 20%.
Mm-hmm.
Now, in the U.S., one of the interesting things is it costs to treat pain. It costs between 560 and 635 billion dollars annually.
That's billion with a B.
Billion with a B.
So that's a half a trillion, about.
About.
So every 2 years there's $1 trillion.
Yeah.
Hmm.
Now, the direct costs are about half that.
Okay.
Okay. And the indirect costs due to absenteeism, I
like
can't come to work today, I've got a
Like
whatever pain.
Lack of productivity. Sure. Okay. I get it. I get it. So pain then is first of all, it's a real thing. We've all experienced it from time to time, and it's a costly thing.
Yeah, now, some pain you say, well, it's not important. Some pain is actually the body's way of protecting itself.
You mean kind of like the body is telling the brain, hey, pay attention to this and get some help?
Yeah. So, for example, the simplest thing would be the example of the hot stove.
Okay.
Put your hand on a hot stove,
Retract it quickly.
retract it quickly. I don't want to get burned, so I touch the stove. Is the stove still hot? Yes, it is. Ow, ow, ow. So it's a lesson. But the other thing is that the pain itself sometimes is, the nature's way of saying don't do things.
Mm-hmm. Okay.
I can remember I was playing a lot of racquetball back in the day, and I went to my doctor and I said, I'm getting some kind of thing in my elbow, and every time I go like this, my elbow hurts.
And what did he tell you?
He said, if I were you, I wouldn't do that. Which, I mean, is true. I didn't make that particular motion of my elbow for about 6 weeks, and it healed up.
Mm-hmm. Yeah, good point. I can remember at CMU when we first got computers. I know we came back from Christmas break, and every professor had a new computer on
Okay.
his or her desk. We didn't know why. It turned out later that one of the faculty had gotten a grant and needed to spend the money. So,
New
and,
computers.
yeah, and for years, I would take Post-it notes and put it up on my computer screen. But I decided I would, learn how to use the thing.
Yeah.
Okay, and so I started using the computer and using the keyboard, and after about 5 weeks or so, I had this excruciating pain, particularly in my right hand, right in this area in here. That's when I learned what carpal tunnel syndrome was.
Yeah, yeah, and people can get carpal tunnel from computers. They can get back pain from sitting in a hunched up position. If you're sitting wrong, you can hurt your back. So there's all kinds of things that can happen. And when you say to people, what's the largest organ in the body? They tend to say lungs or liver, or turns out it actually is skin.
Yeah, right.
So, there's lots of sensitive spots on your skin, some more so than others. You have more nerve endings in your fingers, for example, than you do in your toes. So, turns out that skin pain is one of the most common of pains.
Huh, interesting. When I was preparing yesterday for today, I went and took a look at a couple of TED Talks. There was a TED Talk on chronic pain, and we'll put it up. It's got it from University of Toronto, talking about pain and how it affects individuals. But there was a TED Ed that was kind of interesting that told a story of a man, and I believe this guy was in England.
Okay.
He was a construction worker.
Right.
And this brings us kind of to why we're going to be talking about pain in a TED Talk, in a Psychology Takeaway podcast. So he's at a construction site, and he's walking around, and he stepped on a nail. Now,
Okay.
I think in the story that they said it was a 25 centimeter
Okay.
nail, which in my way of thinking about that, that's a nail that's almost 10 inches long. I mean, it's a big nail.
Yeah, 25 centimeters.
Yeah.
Yeah.
Yeah. And so I went through his boot, and he experienced pain just as.
Of course.
Yeah. I was at my own construction site and stepped on a nail, which went in through my work boot, and I experienced a lot of pain. I could just lay there and scream for Sheila to come out, which she did. So this guy then is screaming. He's in pain. They load him onto an ambulance. They don't touch the foot or anything like that. And all the way to the hospital, as they are speeding and going over bumps and things like that, yeah, he's screaming every time they hit a bump.
Yeah.
Because of the pain that he's in. Get him to the hospital, and the surgeon, emergency room worker, takes off the boot.
Okay.
The nail had not penetrated his foot at all.
Okay.
The nail had gone through the boot, but it didn't go into the flesh.
Okay.
So the
there's-
pain that he was experiencing had to do with psychological factors.
Yeah. So in other words, you can say, well, this wasn't real pain. It
But-
was to him.
It was to him. Yeah. So that's why we're going to be talking about pain in Psychology Takeaway, because there are some people who experience a tremendous amount of physical damage and don't seem to react to it. In his case, he didn't get any physical damage, but he was experiencing pain.
Yeah. Now, one of the things that one of the doctors that I saw at one point said to me, he looked at an injury that I had, which Actually, basically, I turned over my ankle and it swelled up like a poisoned pup. So I said, I better go and see the doctor about this. And I went in and he said, well, on a scale of 1 to 10, what do you think this pain is? And I said, 2 maybe. And he said, your ankle is swollen up to twice its normal size, and you're telling me the pain is 2? And I said, yeah, I think so. And he said, well, you're very stoic.
Epictetus would like that,
Yeah.
right? Yeah.
But I didn't think of myself as stoic. I just thought that, hey, this is a pain. It hurts, but I know I'll get better. He's already told me my ankle isn't broken, so it's
Yeah.
all okay.
It's all okay.
But there are other people who, with the same sensation, might say, "Oh, it's a 9 or maybe even a 10."
Mm-hmm.
And they're not faking it. They're genuinely believing that their pain is about as intense as it could be.
I can remember one time, Ralph, and you and I were fishing, and Sam Miklas was with us. Now, Sam Miklas is the founder of Odyssey of the Mind, or back in the day it was Olympics of the Mind, and you had, or he had, gotten his fishing line tangled up in some way, and so you went into the water to untangle it, and you were about up to your waist or something like that, and you're untangling the line. Now this is up in northern Ontario
In May.
In May, there's still ice on parts of the lake, and Sam looks at you and says, "That Baber's got to be the toughest guy I've ever seen." So maybe you're maybe you just don't experience much in the way of pain. Take a look here. I got a bruise there. I got a bruise there, and I got a bruise over here. I've been doing construction around the house for the last few weeks. I have not a clue as to where these things came from.
Yeah,
You know?
and that's one of the things that are sent to try us as we age. Is when you're 20, you bump something and you say, "Oh, I bumped my arm." When you're
Our age?
our age, you bump something, and then the next day you look at it and you say, "Where the hell did that bruise come from?"
Yeah, indeed. So there are a number of different factors, psychological factors, that mitigate against pain. Gender is a factor. Boys, particularly firstborns, might be told to just buck up, and if you hurt yourself, well, big boys don't cry.
Yeah,
Whereas girls may be encouraged to show some emotion.
yes. Now, one of the things that we have to caution people about is that's a traditional child rearing meme
Mm-hmm.
that boys don't cry. Today, I think more and more people are saying, "Yeah, boys do cry. It's okay."
It's okay. Yeah.
So, I don't know. Jim and I, being old school, were raised in the boys don't cry, and
If you're in
you
pain,
hit your thumb with a hammer when you're first learning how to build things. Your dad will say, "Hit the other nail."
right.
And that was it. I mean, you fell down. Did you hurt the floor?
Yeah. And birth order could possibly have an effect too. The firstborn child may be encouraged to be stoic, whereas the thirdborn, the baby of the family, can be encouraged to be the baby of the family and show those
emotion. Yeah.
So that's one of the factors. Apparently, other factors that we'll be looking at include things like gender.
Yeah.
Women, interestingly enough, have a higher pain tolerance than do men. And this has something to do with the amount of estrogen in the body. So estrogen is a protective factor.
Yeah, and it's also interesting in that women are more subject to intense pain during childbirth.
Mm-hmm.
Now, one of the things that's often said is, women in going through childbirth experience an intensity of pain that a man can never understand or really appreciate, because a man never has that level of pain.
Mm-hmm.
I don't know that that's true, never having born a child, but I do know that some women who go through childbirth seem to do it relatively easily. Other women have really intense, really prolonged pain during childbirth.
Mm-hmm.
And one of the fortunate things about pain is that you can argue that the body has no memory for pain. Otherwise, nobody would ever have a little brother or sister.
Good point. Good point. So, as we take a look then at pain, we'll look at a couple things. We'll look at the subjectivity. That is, how do we really measure pain, and how do you determine how maybe a 5-year-old or a 6-year-old experiences pain? They might not have the words for it.
Yeah.
So there's a test that psychologists use and pain specialists use, where they ask the child to point to a picture of a face that kind of reflects what they're experiencing, what they're feeling.
Yeah,
And
so
that's related to.
you have a big smiley face.
Mm-hmm.
I feel pretty good.
Mm-hmm.
You have a frowny face. I don't feel so good. You
Right.
have a face that's crying. Yeah, that's how I feel.
Mm-hmm. Mm-hmm. So, pain experts have been trying to determine more or less objective ways of measuring the subjective pain.
Yeah.
For adults, we can use an interview process where we ask people to describe the level of pain
Yeah.
that they're experiencing, and we can quantify it in terms of a 1, a 2, a 3, a 4, up to say a 10, or
Yeah.
so that we can begin to do some fairly objective research in the whole area of pain.
Yeah.
But we've got to take into account though some of these other variables, some of the cultural kinds of things, and we'll look at some of that as we
Yeah.
go through our series. Just how do we talk about the pain that we're experiencing? If 80% of the folks who are coming to doctors in the U.S. are coming because of some pain-related factor, then doctors are going to have to be good at understanding this phenomenon.
Yeah, and one of the things that is becoming increasingly difficult to sort out when a patient comes in to see a doctor and says, "Doctor, I have chronic back pain and it really, really hurts. It hurts all the time." The doctor has to very quickly ascertain, unfortunately in today's world, whether that's in fact true or is it drug-seeking behavior.
Okay, yeah.
So, I come to a doctor, and a new doctor to me, and I say, "I've got a bad whatever," and the doctor has to say, "Well, is this somebody who's looking for an opioid prescription, or is this somebody who's in real chronic pain?"
Quotation marks, real.
Yeah.
Pain. Yeah. And I'm not sure that docs right now are that well trained to be able to make that distinction. And probably, if a person is in a lot of pain, the multidisciplinary approach would be a good one, where there'd be perhaps a social worker involved to take a look at the social factors. There might be a psychology person to take a look at the psychological factors, and then the physical people would be the the PA or the doc. But that typically isn't done. Typically, it's a nurse in the office and a doc, in the office.
Yeah. So one of the things that as we've been suggesting here, the emotions that you feel during the injury and recovery periods really affect the perception of pain. So you say, well, let's go back to one of my childhood youthful experiences. I had a motorcycle. I fell off it 3 or 4 times, at least a couple of times at fairly high speed. Every time I got up and said, that was stupid. Boy, I'm kind of shook up. I better sit here at the edge of the road for a bit and gather my forces and get back to the point where I can get on the bike again. I did. I got up. I went home. My dad would take one look at me and say, "You fell off your motorcycle." And I'd say, "Yeah, I did." He'd say, "What were you doing?" I said, "Going too fast for the curb." "You okay?" "Yeah, I'm okay." I didn't make much of that emotionally. Kind of like the old athlete, walk it off.
Mm-hmm. Yeah.
But I know other people who come to find out they had a fall or they had a slide or something untoward on a motorcycle, and they walked the motorcycle home or got somebody else to give them a ride in a truck and hauled it home and sold it.
Uh-huh. Okay.
Because they said, this is scary. I'm not doing this again.
Mm-hmm. Okay. Yeah. And the analogy, I guess, is if you fall off your horse, get back on and ride the horse home. Well, we've touched on a number of things here to kind of open up the discussion about pain, and we'll be having this conversation over the next 3 or 4 podcasts. So until next time, this is Jim
And Ralph,
saying,
keep your stick on the ice.
because we're all in this
Together.
together.